If I have a suicidal patient in Tipperary, I have to send them up to a busy emergency department. In Waterford, it's very much a community-based psychiatric service. We have a consultant psychiatrist who visits our health centre in Waterford every 2 weeks. We also have a facility called a SCAN nurse, which is a suicide crisis assessment nurse, and that's someone that we can ring up if someone's in crisis and can usually get them seen within a day or two in our practice, And there's evidence and research has shown that this reduces the admission of patients with suicide, On the alternate side, in Tipperary, unfortunately, we don't have access to this nurse, And we lost our hospital 12 to 15 years ago. We were promised lots of community services. Unfortunately, a lot of those services have remained unfilled, and we've several locum psychiatrists, and we've had several vacancies in all sorts of psychiatric posts. So unfortunately, the contrast is quite significant between my two health centres in terms of community psychiatric services. If I have a suicidal patient in Tipperary, I have to send them up to a busy emergency department. If I have a suicidal patient in Waterford, now sometimes we have to send them to hospital if they're extremely poorly, but generally I can call a nurse. It's an experienced psychiatric nurse who will see them in our surgery, potentially the day or two afterwards, and the patient knows they're going to be seen, and then they're filtrated directly into the psychiatric service. It works in Waterford. And there's ways around this, and we have to think outside the box in Tipperary. I would say we have a fantastic local hospital in St. Bridget's Hospital. It's got end-of-life care suites, which have been given by a charitable organisation. It's a great step-down facility. We've recently had a large primary care centre built a year ago. Unfortunately, it hasn't really been staffed adequately, and there hasn't been significant extra services given to the community. In terms of young people, I would say that the psychiatric service for young people is inadequate in Tipperary, with extremely long waiting lists, which is the case all over the country.